Hello everyone, this is Venus Brown of Diverse Spectrums. I am sorry if the lighting on this is too bright. It's just that time in the morning where it's very bright on one side and not so bright on the other side, and it's not ideal. I've been trying not to do my recordings in the morning, but I needed to get this one done because I still have a couple other recordings that I have left to do. I am bringing you our next Digging Deeper episode. This one is a little bit different. It's actually about some pinched nerves that I've had recently. I wrote this blog several weeks back. I do this with a lot of blogs. I'll write my blogs first, and then several weeks later, I will usually do a video to go with that blog post. Because this is specifically about my own personal issues, there should not be a long citation list at the bottom of my video. I came up with this topic after looking into more information about one of the medications that I started taking because of my pinched nerves. The pinched nerves that I've been experiencing are giving me really bad muscle spasms, severe pain, tingling, numbness, and weakness from my neck into my entire left shoulder, down my arm and hand, all the way to my fingertips. This week's post will dive further into pinched nerves, my experiences with them, and the connections these nerves have to other parts of our bodies, as well as other functions and behaviors. Since this is on a sensitive medical topic, I am going to add an important disclaimer here. I am not a medical professional. What I state here is not medical advice, and if I place information or suggestions here, they are either based on my opinion from experiences or from other authorities, but they are not my professional advice to anyone. If you are having similar struggles with pinched nerves, severe pain, tingling, numbness, or weakness from a possible pinched nerve, you should seek help from a medical provider who can address your specific symptoms and needs. Let me be clear. Some of the symptoms I describe can occur for a lot of different reasons, some more severe and some less severe. So doing simple Google searches to try to explore what you are experiencing can bring you a lot of distressing and sometimes misleading information. Sometimes that misleading information can lead to incorrect ideas that maybe you don't need to see a medical professional, which can contribute to important issues being missed, leading to worse problems in the future. I am not saying not to do your own research, to ignore everything that you find in a Google search or everything you hear from others, or to ignore your own body, its signals, and your own experiences. But I am saying that there can be a lot more involved than what we learn from all these other things. There can be misleading information guiding you down the wrong path. And when you are having serious medical problems or issues that you do not understand, there may be good reason to see a primary care provider or a specialist who knows more about what you are specifically experiencing. I'm also not saying the provider or specialist you go to will know everything, but hopefully they can evaluate what is happening and get you a little closer to finding accurate answers to what you are experiencing, a regimen to help you improve safely, or at the very least, rule out some things that may cause similar symptoms. All right, now that that is hashed out, I will give you a rundown on my past and current experiences with pinched nerves and maybe some background story to add context to why I've developed some of these issues in the first place. I guess the first really big issue started while I was in the U.S. Army. I think because of some of the heavy lifting, repeated movement, and stress on the body from handling my job as a wire and cable installer, as well as other repetitive work responsibilities, I started to experience more wear and tear on my back than would have been usual for a person my age. I began to experience severe back pain in my early 20s. I had no previous history of back problems, nerve or muscle conditions, or problems with my bone structures. Outside of previously diagnosed allergies and some breathing problems, I was by most accounts a healthy young adult who was declared female at birth and had no underlying issues. Anyway, I started experiencing severe pain in the center of my back, sometimes dull and achy, sometimes sharp, excruciating stabbing pains that would radiate from my center back into my chest and sometimes all the way down to the end of my arms. After multiple visits to military doctors, physical therapy, repeated prescriptions of ibuprofen that did little or nothing for the pain I was experiencing, x-rays, and too many profiles saying I shouldn't exercise or carry on with regular physical work, which people in the military really don't like, I finally convinced one of the military doctors to run an MRI. And yes, that was after a lot of internet searches on my specific symptoms, because what they were doing and the things they were finding were not working. The pain that I was experiencing was definitely real, even though they were trying to act like it was imagined. The findings, which x-rays and bone scans were not able to detect: herniated and protruding discs in T6 through 11. The specialist then explained that while herniated discs do not always cause pain like I am experiencing, they can contribute to other problems that can impinge the nerves coming from those areas: swelling, inflammation, irritation to those nerves, muscles, and other tissues in the area. Plus the shrinking smaller spaces for the nerves to travel through when that swelling, inflammation, and irritation are occurring can lead to the kinds of pain I was experiencing, even pain in parts of the body that were nowhere near the discs that were herniated or protruding. Now, by the point that I finally got that MRI, my back problems had gotten worse, in part from a severe auto accident that I had in my mid-20s. Who knows, that might actually explain the excessive number of discs that were herniated or protruding. Plus, on top of those issues, I had sustained several fractures from that auto accident. My left hand was broken in many places. I had 3 hairline fractures in my ribs, a couple hairline fractures in my skull, and a small, barely detected fracture in my cervical spine. And another thing that was detected only after kicking a doctor several times while unconscious when they were touching near the area, I had a fractured scapula, which the doctors have said is actually a very difficult place to fracture. So, you know it was pretty bad. I was in very bad shape. The accident was very bad. I was extremely lucky to be alive, and even more lucky to be conscious and mobile after I regained consciousness a week later. It's not something I like to dredge up a lot, but I'd rather get it out in the open than have people whisper, question in their head, or worse yet, drag their kid away, telling them it's not nice to ask those questions, stare, or talk about things like that. A word of advice to those parents who think they are sparing someone's feelings: that can actually make the person feel much worse. Kids are curious, and while it's good to teach them to be courteous and thoughtful with their comments and questions, it's not always helpful or nice to squelch their discussion. I would much rather they ask what happened. I can explain in simple terms that I had an auto accident, I got some scars from it. I know not everyone is comfortable discussing those things, but usually a person really bothered by it will let you know, either with their word, their tone, or their body language. If you're not sure, you can ask, "Are you sure it's okay to say or ask these things of you?" And many people will give an honest answer. Now, if you know your child is intentionally being mean, you can pull them aside to address that or explain a better way to put what they are saying or asking. But I do not recommend stopping your kid from asking legitimate questions that come from a place of curiosity when they are not being mean-spirited. That's just my personal opinion on the matter. Not everyone may agree. Now back to the back pain and the now contributing factors from that auto accident. I won't go into everything that occurred, but given time and aggravation from multiple injuries, I also began to develop arthritis in my back and shoulder, contributing to more pain, which seemed to feed off my other pain and injuries. There were times I would turn the wrong way, lift the wrong thing, stand up the wrong way, and the nerve pain from the pinched nerves would put me out of commission for considerable periods of time. I remember literally laying on the floor at a restaurant one time in so much pain I could barely move, on my back, trying to roll myself along my spine so that it would alleviate some of the pain. I remember at times necessary functions like using the restroom had me in tears. I remember laying around and feeling horrible and useless, sometimes for weeks. Improvements to both my pinched nerves and arthritis came in several steps. First, getting the doctors to stop prescribing me nothing but ibuprofen, which only seemed to help me with my headaches. Next, diagnosing my arthritis and explaining how to better ease it and mitigate the flare-ups. After that, prescribing the medications that would help with the pain without contributing to two primary concerns that the doctors had, possibly being addictive if taken too long, and, because of my head injury, increased risk of seizures. Look, I have been on many combinations of medications to deal with my various injuries, illnesses, allergies, and chronic pain. But my doctors, both the government doctors and private doctors, have been very good about ensuring my safety and that I am not kept on anything addictive for too long. And I have been very honest with them about anything I could impart to give them more information. That has also taught me to always look into the things of that nature when it comes to my own health and my loved ones' health. Sometimes we are our own best educators, but professionals have an important part in that education as well. We need to work together, collaborating with professionals to get the care we actually need. I do understand that sometimes professionals don't want to give the care that we actually need. Sometimes we don't actually know what's going on. Sometimes we know more than what the doctors seem to know. And sometimes you have to really pry in order to get the doctors to do what needs to be done. But I do feel like if you are willing to do the extra work together in a collaborative way and try to keep them informed, try to do some of your own research, everybody listening to each other, I feel like that can help a lot, even though it does not always work. Believe me, I went through years in the Army trying to get these medical doctors to listen to me when I was having asthma attacks that they refused to believe were actually happening. And I went through years of trying to get an answer as to what was happening with my back. So I know they don't always listen, and I know it doesn't always work, but I feel like it's worth it to keep pushing. All right, now that you're up to speed on my previous pain and injuries, we can talk about the current situation. I know this was and will be long, but I felt the need to really fill you in on the context and realities that I had before experiencing this most recent problem. Problems that are actually different from my previous challenges. I had already been experiencing pain in my neck from before Christmas this last year of 2022. It seemed like just a kink in my neck, so I didn't really think too much of it and tried to give it time to rest, to heal. Finally, in January, it seemed to be getting better. One day, I was experiencing pain and numbness shooting from my lower neck through my whole left shoulder and shoulder blade, along with pain and numbness shooting from the shoulder down my arm and into my hands. The next day, I noticed the arm was constantly tightening, and I felt the need to rub it and pound on it, like I was trying to tenderize it or something. That seemed to make it even tighter. I was taking my youngest kid to a scholarship thing for school that day and had to stand in line for hours. It was very hard. I was trying so hard not to show my misery and not to draw attention to myself. But the whole time, the pain, The tingling, the numbness, and tightness were getting so much worse. The next day, I was in such tremendous discomfort. All that tightening in my arm was worse. My entire arm felt really, really weak, tired, and tight. I had already started using Tylenol and some old muscle relaxers, but they seemed to be doing nothing. First, I called the VA, hoping to be seen, but not ready to say it was an emergency. I gave them all the information I could and waited for a call back to set up an appointment. Then I looked up the problem I was having on Google and got lots of information about cervical radiculopathy. I think that's how you pronounce it. I'm not sure. A pinched nerve in the neck. I tried suggestions like heat pack, more muscle relaxers, sitting or laying in an upright position, because that was the only position I could tolerate. More massaging, soaking in the jacuzzi tub with the jets going, not using my neck, arm, or hand, because they were too darn weak and hurting like crazy. But really, nothing was helping, and the VA wasn't getting back with me. I think it was 2 or 3 days later, someone called to set up an appointment. And the date was going to be like 3 weeks from when this started. I immediately stopped them. I said, I really cannot go that long. This pain is really awful. I have not been able to sleep hardly at all. I was really starting to think I was going to have to go into the emergency room. Luckily, there was a morning appointment available in a couple days, but I would have to make arrangements for my kid to get to college and high school. It was a very long day, but I got a new bottle of the same medications, but a slightly higher script. I got labs and x-rays done, took care of other healthcare needs at the same appointment, and went on my way. At the point that I wrote this blog, it had been a few days, and I still hadn't heard anything on the tests and the x-rays. Some of the muscle spasms had reduced dramatically, and I wasn't nearly as uncomfortable as I was. But I was still getting some pain and tingling and numbness. I still had to sleep in an upright position, but I was at least able to actually get some sleep. Strangely enough, I had a couple days where the affected side seemed to get extra sensitive, and even some of my fairly soft clothes felt unbearably itchy. Almost everything I touched felt irritating, except for a couple of my softest blankets. When I wrote this blog post, I was still experiencing some of that sensory sensitivity, and touching certain things, it's almost like I could feel every fiber my hand ran across. I have to say, I was glad when things finally got back to normal. Normal for me, anyway. Might not be normal for other people, but it's normal for me. And I'm sorry to anyone that has had these kinds of experiences with this kind of pain, tingling, weakness, numbness, extrasensory issues. It is a lot to handle. It can be quite overwhelming, and it's hard to explain in a way that does the experience any real justice. I hope I'm not being too insensitive to those who experience things like this regularly. It's just not something that I'm used to. That is the end of this post. I will see you on the next post. I'll see you next week when I talk about those muscle relaxers and about a certain word that came up in a Facebook page that loosely deals with the need for muscle relaxers. That's as far as I'll go. Just know it was a derogatory word. It may be triggering for some people. So I will try to include a trigger warning in the description and near the beginning of the video for next week's post.